Hello and welcome to Everyday Oral Surgery. This is your host, Dr. Grant Stucki. I am an oral and maxillofacial surgeon practicing in Denver, Colorado. The goal of this podcast is to connect, learn, and inspire. In this podcast, you'll be hearing from OMS surgeons all over the globe discussing ways to improve the practice of oral and maxillofacial surgery. Most information shared in this podcast will be based on personal experience and opinions, so please supplement what you learn here with approved research studies. Without further ado, please enjoy today's episode. All right, welcome to another episode. Today I'm with Doctors Alexander Faigen and Samir Singh from Pittsburgh. Thank you guys for joining us on the podcast today.
Thanks for having us.
Thanks for having us, Grant.
Yeah, this is great. Could you guys just start by giving us a brief history of your practice and your training? Maybe we'll start with Alex and then go with Samir.
So I trained at Temple Dental School and then went to a GPR actually at the VA in Pittsburgh. I took an internship at University of Pittsburgh, and then I matched into Augusta University for oral surgery training, formerly Medical College of Georgia. Currently, I'm working, as you can see, with North Pittsburgh Oral Surgery. It's a wonderful group. Samir will give you a little bit more history as well as we kind of get into it.
Nice. Samir, how about you?
Yeah, I went to dental school at the University of Pittsburgh School of Dental Medicine, and proud to have trained at Virginia Commonwealth University, formerly Medical College of Virginia in Richmond. Just jumping right into the history of the practice. So the practice was actually, our main office in our North Hills location was actually started in 1958. Two military guys, George Fisher and Jess Gardner, started it. We had one location. They were then joined by Homer Porritt, who served as the chief of Allegheny General Hospital. He joined several years after our North Hills location was established. Kent Gailey joined in 1976 and really pushed the full scope practice, doing orthognathics, trauma, TMJ surgery, things of that nature. In fact, he was one of the first surgeons to perform orthognathic surgery at our local community hospital that we still maintain privileges at, which is very cool. The North Hills location moved to a different physical space in 1981, and we still actually operate out of that location. We then expanded to a second location in 1985 in Cranberry, which is where we are right now in our Cranberry office. And we combined practices with Dr. Gary Krebs in 1991, who trained at AGH. So at that time, it was 4 surgeons in 2 locations. From 1996 to 2008, Gary Krebs and Kent Gailey worked solo. And then our senior partner, Wayne Rasha, joined in 2008. And he's a very ambitious guy, and like all of us, and expanded out to a third location in our Newcastle area, which is northwest of where we are currently. We had an opportunity to buy another practice, an old periodontal practice in what's called the Natrona Heights area in 2015. Our partner, Sean Marsh, joined in 2018. I joined in 2019, and then Alex joined in 2022. So for a couple years, it was 4 partners with 4 locations, and then we're blessed to have had Stephen Licht, who's been on your podcast a couple times, who trained at UIC, and Seth Lana, who trained at Ohio State University last year. So now we have 4 partners, 2 associates, 4 locations, and we're currently looking to expand to another location. So stay tuned for that.
Nice. And are you guys all doing full scope practice, or what does the typical day look like for each of you?
Yeah, we kind of push each other. We started, we all want to maintain that full scope mentality, making sure that we're providing as much as we can for our patients. Currently, we're working 5 days a week with our schedule focused on the needs of the location. Everyone's a little bit different, but 6 to 8 sedations in the morning, followed by locals and consults for the remaining afternoon. Which gives us kind of good pace to the day, gives us some opportunities as well to see those cases that we need to maintain that full scope, orthognathic trauma and things of that nature.
Very nice.
As a seasoned surgeon, I'm almost 10 years into this thing, and it's nice to have the ability to work a light or a busy schedule, as light or busy as you're comfortable with, knowing that we've got partners and associates to kind of back you up. So, my 2-year-old son had to get ear tubes. I don't know, Grant, if you experienced that with any of your kids, but I had to kind of last minute cancel my schedule, and I knew that it was okay because patients were taken care of, right? So I was able to be with my kids in that moment. But I tend to favor a busy schedule, and I like to take care of patients in a timely fashion without a long wait. I don't know if you guys get that sort of gut punch feeling when a patient says, Dr. Stucki, I waited, several months to come in and see you, and I hope I can get my surgery quick. It's a blessing, but it's also kind of a gut punch to me. It's I just want to get you in and take care of you in a timely fashion. So.
Nice. And then Can you just talk a little bit about how you have maintained your orthognathics and kind of the more full scope practice as you've grown and gotten more associates and things like that? Is there any trick that you've been able to do or thing you've learned there?
At this point, with 5 days a week being open, we've built in half days for ourselves to go to the OR. So on Wednesdays and Fridays, we're ending around 1 o'clock. So we can get over to our local operating rooms. Kind of gives us that ability to maintain that full office schedule. So you're not running out, 3 or 4 months. You're making sure that you're doing the things that keep the lights on, as well as what the patients need. But we also have that OR opportunity. We have several layers of very talented doctors. So the oldest partner, even not saying old in my chronology, what we're looking at is, in our 40s as the oldest doctor. So, it maintains that layer of talent as well. The newer guys that are coming in are pushing each other. We're making sure that we're doing these big cases. If someone has a better idea, we're learning from them. We're working with each other to kind of keep that level of training that we had in training. Kind of that steel sharpens steel mentality.
Just a unique experience that I've had, and I'll kind of touch on this later. I've been privileged to have applied and gained membership into the prestigious American College of Surgeons. And I'm proud to be one of the first within our practice of extremely talented surgeons to do so. So a full scope and a busy schedule allowed for that. We do, as Alex touched on, our bread and butter, teeth and titanium, but we don't shy away from larger cases. I myself have done a handful of anterior and posterior iliac crest reconstructive cases, revision orthognathic cases, tons of trauma, and now building up a larger sort of orthognathic practice. We do injectables in our practice, dabble in temporomandibular joint procedures and nerve repair, but for me personally, that's not my passion or area of expertise. But I'm proud to say that Alex has, being a couple years, 3 years into this now, has gotten busy very quickly, and I'm supporting his endeavor also to apply for the American College of Surgeons membership. So we're helping each other get that caseload, and I think you probably have what 20 to
I think
30,
I
20.
think I'm already there. In the
Yeah.
last year, I might have hit 60 already.
So
Keeps us a good pace.
yeah, and he'll get it easily, and I'll give him a full endorsement, and I think we hope to extend that to our future surgeons. So that's been pretty nice, and also just smart with scheduling, right? So working from 7 to 12 or 7 to 1 allows us to keep the lights on, as Alex says. Orthognathic surgery and major surgery is an expensive hobby, but that sort of smart scheduling and the support of other surgeons working a busy schedule certainly helps with that. And then relationships, I'll touch on this later, but our relationships with the hospitals, leveraging block time, which was really, really difficult for us to get, but proudly we're able to, plead with our local hospital administrators to get us that time. Everything just kind of fits nicely in a cohesive manner.
Nice. And can you talk to us just a little bit about your practice schedule or structure and how things are set up with your partners and your associates?
Absolutely. So when I first started, there was 4 partners, a practice administrator who served as a business manager, a clinical manager, and a front desk manager. As we brought in more surgeons and widened our scope of practice, we had to evolve this model. So we kind of still maintain that mom and pop feel, but just got the right people on the bus, as one of our partners, Wayne, likes to say. So now we actually have a seasoned guy, Kurt Swager, who's our CEO. We have a director of revenue cycle management who oversees the books, accounts receivable, making sure that we're getting paid on the claims. Us being in a blue collar town, heavy insurance participants. We also have a clinical manager, a front desk manager, and then we have 2 implant coordinators and now a dedicated hospital coordinator. So each office has a lead assistant, and we sort of have a flow chart where everybody knows who's their direct report. And so we're able to kind of disseminate information very efficiently and quickly to be able to do that. So now what that does for us as partner surgeons, going back to how we used to do it, we were making all the decisions and disseminating and ensuring that our teams were up to date. Now that's allowed us to be able to focus on surgery and patient care, obviously under our oversight. But I just wanted to give a shout out to Kurt, Jessica, Trisha, and Lori, our management team, to be able to allow us to do that. So they vet a situation, they present it to the doctors, and it's a quick email or a text or something like that to implement, and we can get things affect change within several days.
Nice. Sounds like your associates are doing well. I mean, I've talked to Steven a little bit, but any feedback from them?
Yeah, so I kind of inquire with them what really brought them to this practice, what kind of keeps them excited, what really sealed the deal for them. Some of the stuff they said was really of course, the scope, right? So doing full scope, having the opportunity, the demographic that we work in gives us, an attractive environment to be in, but as well, and you need guys who will treat you like you're a friend and care about you. So, we try and make this a family-oriented practice and all function as close to being good friends as possible. Sometimes it's hard, to keep the business part and the friendship part different because that can become sticky. But, overall, we have a lot of camaraderie and we've developed those personal relationships that make some of these hard decisions a little bit easier for us. And then, from the beginning, we just try and be welcoming. That lunch interview is very much that. It's just casual. It's like having lunch with friends. And, that wasn't something that they saw looking at, other practices. And then another associate of ours talked about just being the larger practice, again, with that camaraderie that comes with it, the ability to grow and lean on each other for the big OR cases or the small implant cases, just gaining those tips from each other, and then the respect within the dental community, joining an established practice. And I agree, being the newest partner and the most recent, until these guys, most recent associate, that respect goes a long way as the profession grows. Having those guys here to push you and kind of keep you moving forward, as well as even expanding your surgical scope and having that group of younger docs with no complacency really kind of is what was the draw for both of them as well as myself.
Constantly challenging the status quo, right? It's easy to get comfortable. Easy and comfortable is good, but I'll touch on this later. But I always try to make myself just a little bit uncomfortable in a safe way because you're not challenging yourself or growing if you're not doing that. So and all of us kind of have that mentality of, hey, don't be afraid to try something new just because it's new.
Yeah, that's fantastic. Any tips on how you've been able to kind of build up your orthognathic surgery caseload?
Yeah, so I really felt fortunate to have this established practice that I kind of just was plugged into. As I joined, I started meeting local doctors, doing CE, trying to just get my name out there in the community. But the office really did it for me. You're already here, you're with this established group. Oh, you know Samir, you know Sean, you know Wayne. So it becomes very familiar to them. And that gives you that level of comfort and that level of excellence that we try and strive for here. With the way that it was set up, I was doing OR cases, I think within my first month. I was credentialed, I was ready to go. I was doing, upper and lower jaw surgery. So getting my name on those op reports, getting my name in front of those referring orthodontists and doctors that kind of see, hey, you're working with these guys. This is the level of work that they're doing. It really made a benefit. And then as I started seeing more patients and being familiar with these orthodontists in the community, I'd start to refer someone who maybe didn't have an orthodontist or, might have needed surgery, but really wasn't sure, just to try and get them in the door. And that reverse referral became a way that I kind of bridged the new guy versus now getting myself some more exposure, which really helped to establish that connection. And then, it never hurts having the ability to work together and to go to lunch together with one of your partners or all the partners and a doctor and really, understand each other, get to know each other on a personal level to build that bond.
Unique things about our practice setup, Grant, is we have 4 locations, but each of us goes to 3 of the 4. So
Okay.
you have an opportunity to meet with different referral bases of different patient demographic. And we're always encouraging, our young surgeons and associates to go get your name out there. Don't be afraid to approach a referral that you don't know and just take them out to lunch, break bread, talk about dentistry, oral surgery cases, and Alex has done a nice job of that in bringing in, and so have Stephen and Seth. But bringing in, newer referrals, that are just starting out and relationships and from dental school and college and things of that nature, and really building up the practice. So you get the opportunity to see a little bit of everything traveling. So I was felt like in training, we spent a lot of time poring over details and prepping for cases, obsessing over those things. And I never wanted to give up that transitioning to private practice. It's really easy to kind of get into that teeth and titanium mentality, and all of a sudden at a blink of an eye, you narrow your focus. I've got to give a lot of credit to Dr. Mark Ox for taking me under his wing when I first got out and allowing me to participate in level one trauma call at the University of Pittsburgh and in that call pool. So I was on staff at 3 level one trauma centers, and I had the ability to work with residents for about 7 years. And that was nice because I was a firm believer that the more surgery you're doing, no matter what it is, the better you're going to be. So I kind of took a step back once I got married and had children and decided to kind of focus more on family, which was absolutely the right call. But my time there was invaluable. I also had the opportunity to take some elective orthognathic cases to the university and work with the residents. If, before having Alex, Seth, and Steven, if the partners were jammed up or, we didn't always have block time. So I was able to kind of take those cases and work with them hand in hand and work with the cream of the crop. In fact, that's actually how Alex and I met, which is during his internship doing some trauma call, late at night. So it was kind of cool to see that him joining come back full circle. But as our practice grew and we started getting more volume and getting more younger seasoned surgeons, we decided to kind of keep more cases in house. And in order to build up a caseload for orthognathics, I always tell Alex and I tell everybody it takes time. These are every minute you spend investing into it will pay back dividends. For me, it started with doing the simple things really well, taking good care of a wisdom tooth patient, orthodontic exposures of canines, having a productive discourse about cases, and being really available and communicative. Referrals are hesitant to refer these cases if they feel like they can't communicate well or their patient's not going to get a good experience. So delivering on repeat good patient experiences will definitely lend itself to them trusting you with bigger things. A lot of, orthodontists haven't seen the virtual surgical planning piece of it. They're aware that it exists, but they don't know what all that entails. So, including those orthodontists on some of the plans, scheduling those things around a lunch hour or on a Friday, because, orthodontists are smart and don't often work on Fridays, allows us to work collaboratively with them. I also approached several local residency programs and offered to kind of do lectures in-house on, setting up those cases. And, we're the exclusive provider for at least one residency program here in Pittsburgh. We've also in the past hosted a orthognathic symposium where we've just basically cold called a bunch of 30 orthodontists in the area and hosted, a lecture, dinner lecture. And then we also were able to have one of the 3D systems planners come in and actually do a live planning for a case. So they could see a case plan start to finish. And then lastly, me personally, it doesn't hurt to have the endorsement of Mark Ox. So me personally, I owe him a lot of thanks for placing trust in me.
Nice. And anything special you're doing with your treatment coordinating and planning?
Yeah, so currently we have a hospital coordinator who helps really get those cases on the books, get them scheduled, work with our schedule both in the office and the operating room. So having that block time is really key to being able to schedule those a little bit further out or get them in quickly. It also helps to relay the timing needs for our surgical surgical setups, the sets that we need, everything that we need to pull, along with great surgical rep support. They're getting in there, they're helping set up for the cases, helping make sure that they're guiding maybe the new scrub tech or the new nurse that's in the room, guiding them through these cases. But we also have just, great staff all around us.
And I just wanted to give a shout out. Karen Penrod's like one of our longest tenured employees at the practice. She's worked every job within the practice. Currently, she's our benefits coordinator. So typically what that looks like start to finish is a patient comes in either pre-surgery or ready for surgery. And Karen will work on the insurance authorizations and is good at communicating with the patient and the orthodontist that they're approved for surgery and following up on those things. And then another shout out to Adi Sholey, who's our hospital coordinator. She actually has an orthodontic background. So for her, it's very easy to communicate with the referring orthodontist, the needs of, surgical lugs, where to put them. And also, she's got a great bedside manner with patients. So she's able to communicate to patients what that surgery experience looks like.
Very cool. And are you guys doing 2 surgeons per orthodontic case, or what does it look like in the operating room?
Yeah, every case, we have 2 doctors. It makes it easy for us to kind of bounce ideas off of each other when you need that little bit extra support. Having a skilled operator across the table from you is always great. It's also very nice to, I'm left-handed, Samir's right-handed. We cut our own sides respectively, and it goes off flawlessly. But we all work together, so it gives you that support. So you're not sitting there struggling by yourself to, hold up and play it at the same time. You have that what I think should be the standard of care, having both, either an associate or a partner across the table from you at every case.
Yeah, it's nice to have the ability to ask other seasoned surgeons for help on, orthognathics or any case. One of my first major cases was actually a submandibular gland removal. I know that that's kind of touchy because a lot of programs that's an ENT sort of experience, but at my training program, we didn't shy away. We had a great relationship with plastics and ENT. So I called my partner Wayne, who's a cutter, so to speak. He doesn't shy away from major cases. I asked if he was interested in assisting, and he had a ton of major cases under his belt, and this is one of my first major cases. So he was able to come in, help pull the right sets, and the case went off without a hitch and was executed flawlessly. We also have fun with it. We had one case, 2021, where we had four of the partners come in all together. So we did it was a reconstruction case for a continuity defect. So we had two guys on the hip harvesting the hip, and we had two guys prepping the neck. And it's funny because our partner Sean is his preference is to assist at this stage in his career and not really seek out being primary surgeon, but he ended up somehow being the primary surgeon on the hip. And when we looked at the reimbursements, he actually got paid the most out of all of us. It was my case, I did all the legwork prepping it, so we always rib him on that. I was like, oh, if anybody has a hip, I'm taking the hip, and you guys can do everything else and round on the patient. So if you want to have another surgeon, it's nice to have that, that schedule where people can be blocked out and leave without really taking much of a clinical hit with the patient load in the office.
Very cool. And you mentioned before that you were doing some other types of, surgery. What other things are you doing in the OR as far as quote unquote major surgery?
So, a lot of pathology, maxillary cysts, anything that we can, safely do within the operating room, within our realm of care. We're not doing free flaps at this point, but, if we were tapped to be part of that, absolutely, we're not doing the harvesting, but you never know if we bring in a guy who does microvascular and that's their dream, we're gonna, meet that head on. It's just really, there's really no limit to what we have available to us. It's just when the need arises.
Nice.
We don't shy away from, reconstructive cases. We have a bunch of iliac crests underneath our belt, and we have privileges to do so within the hospital. Nobody questions that because of our, longstanding relationship and history there. Trauma, you name it, orbits, pleura de dura. We're comfortable. Do we do much of that stuff anymore now that we have families? Not a ton, but I go back to an assistant's son who was unfortunately was hit, punched in the face, sucker punched, and had a ZMC with an orbital component. And we were the first people she called to get her son in and get him taken care of. So we don't have a problem doing that. And we've actually been fortunate enough to see some athletes, some professional athletes and things of that nature within. And actually, in fact, our practice used to be the on-call surgeons for the Pittsburgh Penguins, and we're looking to slowly get back into that. But Kent Gailey and Wayne, I think, used to take call with the Pittsburgh Penguins and address any on ice issues or any issues with the fans.
Very cool. And then maybe we could shift gears and just talk a little bit about kind of what your cases look like in the full mouth rehab realm and your philosophy there. Can you start us off on that one?
Yeah, so I find it hard sometimes to identify these patients, but with a little bit more experience and time out of residency, you start to kind of get in your groove. Some of these patients really know what they want, others have no idea, but we kind of help to fill in the details. But with this experience, with some more time under my belt, it started to become something we can introduce to more of our patients. Showing them some of the benefits of technology, kind of streamlining the process, and then having good mentors within the group as well. It's really helped to kind of keep that something that we're able to offer and offer more and more to each patient.
Yeah, and a lot of people will say they actually appreciate the free advertising from the Clear Choices and Nuvia dental centers. Patients are really looking for somebody they're comfortable with, right? So us being around since 1958 and having that sort of family mentality. I mean, a lot of our patients come in and say, how's your son? How's your daughter? That's how the conversation starts, right? Or I heard you just had a kid, what did you have? And they want to feel comfortable. We've spent a lot of time on the back end preparing literature. So every patient that comes in who's interested in a full arch gets, whether it's removable or fixed, they get a folder with literature, photos. They'll get financing information from our implant coordinators, and they'll get their the coordinator's contact information. Oftentimes we do, another follow-up because it's a lot to take in. We tell them to give them some space and we follow up with them. And what I've found is a lot of patients are actually thankful that someone takes time to discuss all options in such great detail. And I was listening to your last podcast with Dr. Bagari, and like you got to treat each patient individually. You got to zone out what else is going on in clinic. If somebody, I had a patient that had extreme dental phobia that came from one of the clear choice centers, and that was a 30-minute consult. Did I get behind? Absolutely, I got behind. But she needed that extra care as an upper and lower arch, and we were able to get her to feel comfortable in that moment to get through the care. So I think it's a combination of that patient-centric care and dialogue, but then it's also, having your stuff organized, right? So having literature, we're in the process of revamping our website, but we have befores and afters. Patients have a flip book of photos they can look through to see before and after cases. So, just really educating the patient.
Awesome. And then as far as building up full arch practice, I mean, anything there with the way you advertise or, schedule your patients?
Yeah, there's a lot that joining this established group has really taught me, kind of cherry picking from what they've already, set up in their own practices, but just kind of leaning on them for support and education. It allows you really to create that flow of best practices around these larger cases and support each other's needs. We're talking about our new website. A lot of it has to do with, search engine optimization, you know, creatively placing advertisements, but just being available. Some of these patients that come in don't really have the education on this information. So kind of getting them up to speed on what is now, our standard of care, what we're able to offer. Sometimes just giving them that information is what you need to start to build it. And then, identifying these patients, kind of pulling them out of your normal patient population, saying, hey, look, this will really be something you benefit from, and getting them with the right restorative doctor can really help kind of speed that process along, not just the surgical end, but you got to make sure that you can finish what we set up.
And I noticed historically within our practice around 2020, 2021, these types of cases really started to pick up. But at that time, as we were kind of evolving, we didn't really have that infrastructure in place to make it easy for a patient to understand, or a referral. So we kind of had to work backwards there and really get comfortable with the steps surgically and restoratively, so that we were able to kind of better educate referrals that may not feel as comfortable. And we regularly revisit these types of topics. I mean, in fact, last month, every year we have what we call the North Pittsburgh Oral Surgery Summit, where all of our partners and families and our CEO, we all get together for a weekend away at Bedford Springs. And we spent probably a good 45, 60 minutes just talking about how we could clean up the full arch.
Just that segment.
Just that segment. We had a whole morning where, the partners met from 8 to 1 o'clock just to talk about our day-to-day operations, and probably about 30, 45 minutes with just that piece. But, as we identified good restorative practices who are comfortable restoring the cases, we started working with them more. Communicating was very key in this. And then we were able to kind of talk through their workflow with discussing finances and sort of present our challenges as a heavy insurance provider. We then started with, analog conversions within the office, and then have slowly evolved into doing a fully digital workflow. And a lot of credit goes to Alex for bringing that sort of piece to our practice, especially with the 3D printing. So now, in order to sort of increase case acceptance and build a caseload, we've kind of taken ownership of the process. So now a patient comes in, we present everything start to finish. We can take them through their provisional. And if the dentist is comfortable and has restored these types of cases, we're allowing them to participate with as much or as little as they want. And some novice practitioners who are looking to do these cases, restore these cases, have actually come in to watch surgery, and I encourage them to do so they can get comfortable with the steps and componentry. And now, we're comfortable adjusting occlusion, 3D printing a provisional, delivering it to a patient, bringing them in every couple weeks, tightening the prosthetic screws, making sure nothing's high, making sure occlusion is balanced without cantilevers, and we can kind of scan that provisional, ask the patient what kind of changes they want to the provisional, make adjustments, and then have the dentist be a part of that process, and then go right to a final and have the dentist deliver the zirconia final, or we can deliver it together. I have a case where I'm delivering a final zirconia with the dentist there just to feel comfortable. So it's nice to we have to be knowledgeable and take ownership of the process, good or bad. And I found that you got to be accessible and be kind of a backstop to get people more comfortable with these types of cases, because they are very technique sensitive, and start to finish, it has to be crisp.
Nice. Any tips on how you guys talk with the patients about finances and increase your case acceptance?
Yeah, there's always a learning curve. We rely heavily on our implant coordinators in our billing department to get those numbers out in front of the patients quickly, so they can start to plan for this. This isn't something that most people have, that amount of money just lying around. So we need to work on them with, not only our financing, but just the kind of planning it out, letting them see the process, 4 to 6 months after the implant placement, letting them know that this is not just all a lump sum. We also try and show them the value in the product. Not only that, but our service that's related to both before and afterwards, as well as the guidance they'll have along the way. So, it's not just you show up, you have the surgery, and see you later. We try and make this that, once they have this procedure done, or any procedure at our office for that matter, they come back and they know that they're able to get help, the same day. If we're not available, someone will get them in. We make sure that that's not just, the maintenance is kind of the warranty we provide with that.
And we did an extensive lit search on American College of Prosthodontists, and we've devised a little cheat sheet. It's not out yet, but we're laminating it, and we're getting a little cheat sheet for our referrals of what to order, where to order it from, overhead, what's their overhead going to be, what's their margin for profits, and the American College of Prosthodontists, how do you maintain these things? What's the standard of care? We're not going to just place the implants and let them go. We're going to back up our work and make sure that it's well cared for and well maintained. The other thing that we've done is partner with a third-party financing company called Cherry. And what's nice about them is they've been able to patients that wouldn't otherwise feel comfortable doing these cases. That's helped us increase our case acceptance. The nice thing about Cherry is it doesn't hurt the credit score of the patient, and they have a pretty good acceptance rate. And Kate Robson and Audie Sholey are great at explaining these things to the patient, as well as Karen Penrod.
All right. And then what type of technology are you using to make these cases go well?
Starting off with from our CBCT, we've upgraded in all of our offices, getting the latest technology, not just in the hardware itself, but the software. Having a good, some of it's a little bit of AI to clean up that CT scan, so you're looking at a nice image quality. And then we go to our photogrammetry and grammetry units. An intraoral scanner that can really capture soft tissue is vital in these cases, as well as the photogrammetry, which takes that conversion process and really speeds it up. And then I really felt it was important, so I kind of pushed the envelope on 3D printing. Bringing in a 3D printer not only for your guides, but for your prosthetic, really increases or decreases that turnaround time, but increases your capabilities within the office, doing repairs, things of that nature. So I think having one of the three of those by itself is great, but having all of them together really makes it so you can do it not only in-house, but do it well, and continue to push the envelope on what's possible for our group.
It's been a journey, right? So as I mentioned, we've evolved, as technology has evolved. So we've used the high bridge, we've used the OptiSplint, Micron Mapper. I just recently acquired the Tissue Mapper, and I'm going to try that CT scan workflow with the Tissue Mapper. We have a Trios 5 intraoral scanner, the Aoral Scan Shining 3D scanner. And then I also just gave a webinar on the ZimV scan bar, which is just a way to basically avoid having to use bone screws or fiducial markers during surgery. So we've beat up every single way, and we've vetted every single way so that we know that we're offering the best standard of care and the most up-to-date care for our patients.
Awesome. Are you doing these guided, non-guided? What's the usual flow?
Yeah, it really depends on the case needs, right? Number of arches. If you're doing a single arch, a lot of times you can either do it guided or non, but doing it, with this digital workflow that we have, the quality of bone, the restorative needs, that all kind of really pushes us on the decision process. But with photogrammetry and grammetry, we're able to really maintain a high quality output of the prosthetic design based on where we have the quality of bone and quantity of bone. So, if you plan it, sometimes those plans, you go to place your implant and it just has no bony support. So we're able to kind of on the fly change position, get a new scan at the end of the procedure, and really, use both a non-guided and guided approach to really give us the benefits of both.
In my hands, if a patient has a large skeletal discrepancy, a severely collapsed vertical dimension, or is a double arch, I tend to do it guided and have a lab come in and provisionalize, obviously with my supervision. But single arch cases with a straightforward occlusion, totally comfortable doing everything through provisionalizing, 3D printing in the office, delivering and doing occlusal adjustments. And we've actually trained our staff in polishing, glazing, and staining the dentition that we deliver, and they've done a really, really nice job with that. And there was talking about working together in the collaborative piece. There was a day that I was doing a double arch and Alex was doing a single arch back to back in the office, and I jokingly before he started his case said, "Hey, Alex, I got your surgical guide right here. Let me know if you need me." And we always take pride in razzing each other, having fun with it as well. So.
Very cool. And for your referring docs who, maybe don't have as much experience with these various technologies and software, anything you're doing to help train them?
Yeah, a lot of it's just that one-on-one discussion, being accessible. You have my phone number, I have yours. Call me if you need anything type of mentality. But the demonstration, providing mentoring for their needs, bringing them in on cases if they've never seen one or only seen one at a CE event, getting there, actually walking through it with you, walking through the restorative process is a huge help. But quite often I find that, those discussions help spark new ideas. They might say, well, have you tried this? Or, what do you do in this case? It kind of makes me start thinking and helps us to develop nothing new, but just to kind of reinvent and upgrade what we're doing as we, currently try to just make those methods cleaner every day.
Yeah, and one of the nice things that we started with our practice is we have a consignment program for our implants as well as the multi-unit abutments. So, in order to, as a service to the referring doctors, we actually will select and place those multi-unit abutments. And they don't have to worry about that. So that's less overhead that they have to worry about. We do that as a service to them. We have study clubs that we've organized within the practice. We also have hands-on training. We partnered with ZimV several years ago to have our top referrals fly out to Carlsbad and do some hands-on training, which was great. And also, like Alex said, just having the referrals come in and be a part of the process. And I've been lucky to be a key opinion leader for, do some speaking for Zimmer, Implant Direct and BioHorizons. So having those PowerPoints and sharing that information and just inviting them to maybe a webinar that, we're putting on as a practice has been nice as well. So just really communicating and education and hands-on comfort, knowing that your surgeon is going to take good care of the patient, do the right thing, and deliver a good quality product.
That's awesome. Well, this has been a good review. I appreciate you guys running through some of your techniques, your practice, the way you've set things up. Super helpful. Just end with some rapid fire questions here. What's the best book you guys have read in the past year?
I read a book called Never Split the Difference by Chris Voss. He's a hostage negotiator or former hostage negotiator for the FBI. I'm not sure if I use it more for my patients or my 4-year-old, but it really helps me to kind of, learn the human aspect of it, how to, not just the win friends and influence people type reading, but something more practical, trying to, notice how you speak and how you interact with patients and people in general.
Mine has to be Atomic Habits by James Clear. So, one of the pieces that was super interesting in your last podcast with Dr. Bagari, What do you do outside of practice to, what's your advice to do? What other things do you do? For me, I think a sound mind and a sound body is very important. Last summer, I made the decision to get a sort of a whole scale lifestyle change with nutrition, exercise, and meditation and mindfulness and things of that nature. And I'm down 18 pounds from last year, and it's this book kind of tells you got to take small steps and sort of be the designer of your world, not just the consumer of it. So it kind of empowers you on how to make meaningful habits. So something that seemed not really accessible to me a year ago. Oh my gosh, I got to get to the gym three times, 4 times a week. I got to do, 8,000 steps a day. I got to meal prep for a week is now just second nature.
Nice. Was there a certain book or diet or thing that you're following in order to find those gains?
Yeah, so I'm working with a company called KMAC Fitness. They're actually based out of London.
Okay.
So it's all virtual. So I'll I have to weigh myself daily. I have to log my weight. I have to log my steps.
Never fun.
I no, I have to take shirtless photos that I don't share with anybody, just to see the progress.
I'd like to see that album.
Yeah, it's pretty interesting. But they also provide you with meal plans and guidance along the way for sort of how to make these changes. So it's been pretty cool, and investing in yourself, in your mind, your body. Is super important, especially as a surgeon, because if you're not healthy and you're not in the right headspace, you're not going to be able to perform at a high level.
Oh, for sure, 100%. So key to be living a healthy lifestyle. Next rapid fire question is, what forceps do you use to extract tooth number 14?
I call myself MacGyver, based on, my experiences. I'm fresh out of residency. You have that, whatever you give yourself, whatever you're given, you use. Depending on the status of the tooth, it could be a number nine. Most of the time, I just do classic 150. I do like the flat beaks instead of that rounded edge to get a nice grip on the tooth. But if you give me a lower and I have to make it work, we can.
Nice.
I'm kind of the diva in the practice, so to speak. So my staff is so fondly nicknamed me Dr. Needy. So if there's an instrument that exists in oral and maxillofacial surgery, it's probably on my tray or on the countertop. But I'll start with a soft tissue reflection with a periosteal. If it's a site where I want to preserve a lot of bone and be very careful, I'll start with a periotome just to luxate, and I'll take the angled elevator, and then a 150 forcep. If it's a root canal treated tooth, sometimes I'll section
Straight
it
to the
and then
drill.
straight to the drill, and then deliver with rongeurs actually each root.
Nice. Love that. How about best movie or TV series you've seen in the past year?
We do a lot of like recycling of, TV shows. American Primeval was a wild one. I always try and stay in touch with my feminine side as well. We watched You. It's a great one, and
That's a
there,
great one. Yeah.
recent updates and seasons, and every time they come out, we just try and hit them from the beginning and catch up where we are. But I just, whatever my wife tells me we're watching that night, I usually fall in line, and it's, sometimes I'm pleasantly surprised. Sometimes I try and take a nap.
My 2-year-old loves Melmo, as he calls them, or Elmo. So we do a lot of
All that
Sesame
Sesame.
Street. Yeah, a lot of Sesame Street in this house. But we just finished You as well. And Your Honor was a really good one that my wife and I enjoyed. It's with Bryan Cranston. And he's just great in that sort of gray area, gritty, sort of a nice guy being forced to do bad stuff. I think he's really good with that. And I'm also, when I'm not around, my wife watches a lot of like those murder mystery things, which is deeply concerning to me because I'm not sure if she's just genuinely interested or plotting my demise some days. But she watches that stuff. I don't like to watch too much of that stuff before I go to bed. Makes for some pretty weird nightmares.
For sure. How about favorite quote? Any quote or mantra come back to you guys over and over?
I go back to Dr. Seuss. Having a 4-year-old, we read a lot, just different stories. But one of my favorite things that he writes is, you have brains in your head, you have feet in your shoes. You can steer yourself any direction you choose. Kind of, write your own destiny. You're your own advocate. I just think it's, powerful. Just kind of, as I think about reminding my 4-year-old, you're kind, you're smart, you're beautiful, you're funny. Just like that self realization of things and trying to be, an advocate.
One of my favorite ones is Ralph Waldo Emerson. It's what is success? To laugh often and much, to win the respect of intelligent people and the affection of children, to earn the appreciation of honest critics and endure the betrayal of false friends, to appreciate the beauty, to find the best in others, to leave the world a bit better. Whether by a healthy child, a garden patch, or a redeemed social condition, to know that even one life has breathed easier because you lived, this is to have succeeded. I had a lot of deep conversations with my mentors. When you're in training, you have your sort of path carved out for you, but then whenever you get into practice, it's kind of, you almost have to find your identity, right? And I was pretty precocious in having those kind of deep conversations, like, what am I doing here? What do I want to be? And the last, I don't know, several years that's found me peace is just establishing a good legacy. I don't need to be the best. I don't need to be the richest. I don't need to be, and I'm certainly none of those things. But one thing I'm proud of is the fact that, have the respect of my partners, surgeons in the community, and just looking back, hopefully my kids will be proud of me. So that's why that quote really resonates and hits really well with me.
Love that. That's awesome. Well, that's all I've got for the questions here. Any other final parting words you guys had?
Thanks so much for having us. I think it's always important to recognize where you came from and who your support has been. Thanks to all the current partners, Wayne, Sean, Samir, our associates, Stephen and Seth, their input, I learned from them as much as I hope they learned from me, our managers and our staff, as well as mentors along the way. I always think of Coach, we call him Henry Ferguson, Mark Stevens, Jeffrey James, all these guys have helped shape me in my career, as well as the guys at Pitt when I was there as an intern and even my GPR, just kind of taking a little bit from everyone along the way has been really, formative in my career. And I hope to continue that and be able to be one of those people to someone else in the future.
Grant, I want to thank you actually for doing this. I think it's a great way for surgeons across the country to collaborate and you get to know different ways of doing things. I'm a firm believer that this type of discourse and dialogue is so great for our profession. So you've very quickly become a great ambassador for the profession. So thank you for that. The founding fathers of the practice, Fisher, Gardner, Porritt, Gailey, and Krebs. Without them, sort of fighting the fights and paving the way, we couldn't be here. Current partners, Wayne, Sean, and Alex, our associates, Stephen and Seth, our managers and staff, my mentors, Omar Abubakar, Rob Strauss, George Deeb, Dean DeLuke, who was on your podcast a while ago, and Mark Ox. We have been privileged, with having a partnership with the residency program to have residents and surgeons come shadow us or participate, in OR cases and sort of see what the flow of a busy private practice looks like. So we're going to leave our contact information. If there are residents locally or if any of this sounds interesting, we'd love to have you. Spend some time with us. Certainly, if you're looking for a full scope private practice, enjoying a busy private practice, and keeping your full scope skills sharp, come check us out. We've got an Instagram, North Pittsburgh Oral Surgery. We'll leave all this with you, Grant. I've got my Instagram page, ssing_DMD_FACS. Alex is PGHOMS. And then Facebook, we have a North Pittsburgh Oral Surgery page, and we'll leave our emails and cell phones. But please don't hesitate to call, text.
Yeah, slide in the DMs, whatever you guys need. We're here. This has been a great opportunity, and I hope to talk again soon.
Yep.
Awesome. Thank you, guys. I really appreciate your time. I'll put your contact info in the show notes. And as usual, if our listeners have any questions, they could reach out to me or to you guys, and we can get them their answers. But thank you again. Appreciate you guys.
Thanks so much.
Thanks, Grant.
Have a good day.
You too.
Bye-bye.
Thank you so much for listening to this episode of Everyday Oral Surgery. For more information on these podcasts, please visit everydayoralsurgery.com. I love feedback and would be very grateful if you would reach out to me via my email, grantstucki@gmail.com, and let me know what you thought of this episode. Or you can text me at 720-441-6059. Additionally, if you have any topics you'd like to hear about, or if you would like to be a guest on the podcast, please email or text me. I found many of my interviewees through people who have been contacting me and have been listening, and I've gotten so many great ideas for more podcasts, and that's what helps keep the podcast rolling. So I really appreciate you making that extra effort and helping me out with feedback and knowing what to do next on the podcast. Thank you so much.